The great state of Texas is not so great when it comes to health care. Texas leads the country in the number of Medicaid patients. It leads the country in uninsured but employed working adults. It leads the country in bankruptcy due to health care debt, and it also leads the country in alcohol-related and total road crash fatalities. I think the state of Texas has to be more accountable for health care.
It's going to become increasingly difficult to maintain the quality of care in terms of recruiting good people, both physicians and nurses, maintaining technology at the state of the art that people are used to, and I think there's a real danger of an erosion gradually of the quality of care over the next 2, 3, 4 years. What the public needs to understand is getting to a point now where it's going to affect them at a personal level. And it's really in their self-interest that they have to take some interest in this issue, because it's going to affect access to care, both for them and their family, not just only emergencies, but routine care.
A lot of folks don't realize that once you get in that ambulance and you're taken to the ER, your care is only begun at that point. You need, most times, it'll be a specialist to continue your care. The ER physicians at that point will call in the appropriate specialists that are on call. If you don't have any on call or they refuse to take call, your level of care at that point will cease and stop, if you will, until alternate means are found, whether it be in another community, another city, but they've got to get you to that care.
One of the critical factors we've noted recently is a lot of MDs are leaving town. We've recently lost 2 very fine young anesthesiologists. We're going to lose an orthopedist who's very highly regarded in town. The other key issues is you're going to have older physicians who are very experienced, good doctors, retiring early because of the situation. A lot of doctors are quitting hospitals or going off call because of the uninsured population. And it's going to be very difficult to recruit good people, both nurses and everybody else.
By July of next year, at least as far as orthopedics is concerned, there'll be a crisis in Victoria, Texas. I mean, it will be that you will not have access to an orthopedic surgeon every night of the week or every weekend if we don't get somebody else in. As far as the other services, I can't tell you, but I know there are nights when there's not a neurosurgeon. If you have a head injury, you're already transferred out of town, at least a third of the time.
I mean, we're losing doctors, and that increases the workload on all the other physicians. We're losing an orthopedic surgeon. We've lost a neurosurgeon, which we can ill afford to lose, pediatrician, and I believe we're losing, what else? Orthopedic neurosurgeon. Oh, we've lost 2 anesthesiologists also, which really puts a bind on us in the OR.
For instance, right here in Victoria, as of this year so far, we're losing 3 highly qualified, very skilled physicians, and I know of at least 1 more that's planning on leaving probably early next year.
So far this year, we've lost 5 young physicians. We've lost an orthopedic surgeon, a neurosurgeon, a cardiovascular surgeon, and 2 anesthesiologists.
Well, I kind of agree with my colleagues that think we're reaching critical mass. There's going to come a time where you're not going to have certain specialties available in the emergency room. Right now, we have certain specialties that are not available 24 hours, 7 days a week. I mean, we only have 2 neurosurgeons in town now, and they're not taking call every other night. We manage as best we can, but if serious trauma comes in, we're already in a shortfall, and those patients have got to fly out of here to San Antonio or Houston, wherever a neurosurgeon's available. So we're already at that point where when you need the services, they may not be there.
The reason I hear for some people leaving the reasons are payer mix, which is we have a very high percentage of either no pay or unfunded patients. The amount of call responsibility there is. There are other places you can go that are advertised that send out recruiting letters saying no managed care. Your call is much better. Fewer unaligned or indigent patients.
And what's going to happen there's going to be a bus full of children that's injured with no orthopedist on call, and all 20 children are going to have to be transferred to San Antonio.
With the emergency care and trauma care both, I think they're both very important. You can have all the money in the world, but if we cannot train and recruit and maintain here the level of quality care that we presently have, they're going to be just as dead or on a helicopter to Houston or San Antonio. And hopefully they make it. Maybe they will, maybe they won't.
They may be shocked and surprised to realize that the specialist that they need to see may not be there, either because he's quit the staff, he's gone off call, like I did at age 60, or they can't recruit this particular person, and the person they need to evaluate them is no longer there. So the issue becomes they're going to get a suboptimal evaluation in the ER, or they're going to have to go out of town for care. Trauma situation, you or your loved one could be involved in a severe car accident, say have a closed head injury, and you may roll into DTAR or Citizens ER, and lo and behold, even though you expect it, there's no neurosurgeon on call. There's nobody available. So the golden hour where you're critically ill and things need to be done very quickly, you're going to be put in a helicopter and transferred to San Antonio or Houston, and they're going to lose critically important time in taking care of you, and you may have an adverse outcome because the specialist that you thought would be there is not.
But if you were to want to summarize this issue with one photo, you would go to each emergency room, and in each emergency room at both hospitals there's a whiteboard that lists the on-call physicians. What's going to happen if this issue is not addressed? There's going to be a lot of blanks on that on-call board. And when you come in and you need that pediatrician, that orthopedic surgeon, that neurosurgeon, there's not going to be one there. And if you were brought in by ambulance or by helicopter, you're fixing to get in another ambulance or another helicopter, and you're going to San Antonio, Houston, or Austin, because there's not going to be any here on call.
If you don't have accessibility to health care, if you don't have accessibility to a doctor at a time of critical care, it doesn't make any difference if you have health care insurance. You're still not going to get the care, and you're still going to be in a situation to where it could cost you your life. So the people, the citizens of Victoria that are paying their bills, that have health care insurance, that have good jobs, they should understand that this affects them also, and it affects them by just maintaining the accessibility of our hospital ERs and our critical care physicians that we have to have in those kind of situations. That's why it affects those people.
If these older doctors retire, you're looking at increased workload for these physicians, and you can't be on call 24 hours a day. The hard thing to get across to the lay public is when these physicians are gone, when you don't need the resource, you don't realize it's missing. But when you come into the emergency room, I don't care if you're funded or not. You can have the best insurance in the world. You can be the wealthiest person in this town. But if your kid falls off their bicycle and cracks his head, you're not going to be worried about why did that neurosurgeon leave? How come we don't have a neurosurgeon here? You're not worried about it then. You're worried about if your kid's going to survive that flight to San Antonio to be seen by a neurosurgeon. The problem presents itself acutely to the public when what we need to do is take care of that problem now.
Well, I think actually we're very fortunate here in Victoria in that I'd have to rate us an A, and that's quite frankly one of the reasons I and most of the physicians here in town are here or have come here is because the medical community and situation here is above average, certainly for Texas.
For the technology we have available to us in Victoria and to the hospital services that are available, for our size community, we deserve an A. For the array of specialists that we have available, we deserve a B, but our grade is falling fast. We are now in a position where, having lost 5 young physicians so far this year, our emergency rooms are becoming less well covered.
When I came to Victoria about 15 years ago from a larger community, I was amazed at the quality of care here. I think we're very fortunate to have 2 superb hospitals, very well staffed, excellent physicians in a lot of specialties. And I think we're in danger of losing that because of some of the issues of uncompensated care and access to care.
Medicine in Victoria is really pretty good. The major problem most healthcare delivery systems have in Texas is the number of uninsured people, or basically insured uninsured people, people who have insurance whose deductible is so high they can't pay it and they can't afford to go in. And these people tend to not go get the preventive care they need.
I think we have a really good health care, hospitals, doctors, all the supporting agencies that support health care in Victoria. Obviously we're a sort of a regional medical community. A lot of people come in from the smaller cities around Victoria for health care. It's been a really stable growth industry for Victoria through the ups and downs of the economy. Our healthcare industry's always been there on a solid basis. I think we have two really fine hospitals in Victoria.
Unless there are programs implemented that would augment the reimbursement for hospitals and physicians in the greater Victoria area, that we will be unable to provide the same level of services in the future that we're providing today.
It markedly impaired our ability to recruit new physicians to town, certain subspecialties, because we can't compete with larger communities who have hospital task districts or other kinds of funding for care, and it's put us at a tremendous disadvantage. The hospitals here, for example, have a huge amount of debt due to unmanaged care. DTAR, for example, when I was on the board last year, gave about $12 million of uncompensated care, and Citizens probably substantially more than that.
Victoria is the only major metropolitan area in the state of Texas that doesn't have some kind of a tax base. Have a trauma district or a hospital district or emergency services district, or have a federal or state funded hospital. I think Victoria ought to seriously consider one of two things: either to increase the number of individuals eligible for the county indigent program, or to create some kind of a taxing authority that provides payment to physicians for caring for patients who don't have insurance.
Victoria County Medical Society has prepared a long list of healthcare solutions which we have sent to all the political representatives, including those on the Healthcare Finance Committee for the state of Texas. We just have to provide the incentives to recruit doctors if we want them. And if we don't want them, that's okay too. But don't be surprised when an emergency room closes. And if that happens, a huge number of employees and their families will be out of a job. If that happens, a huge tax base for Victoria County and the city of Victoria could be lost, and nobody wants that to happen. There are many economic incentives that can be provided for hospitals to keep their emergency rooms open and to recruit and retain physicians on their house staff.
Solutions, I think, in general, to try to attract people into an area where there's a high indigent population, which appears to be getting higher, would be a viable county indigent program. If physicians coming knew that, yes, I'll see someone who has no money, but the county is going to pick up at least some payment. Calhoun County, for example, has a good county indigent program. They pay the docs to something to see people who are in their indigent program. Victoria has a county indigent program, but it's ridiculous. The definition of indigent is so small that there's maybe 100 people or so that meet that in this town, and it's ludicrous.
We need to come up with some sort of, I would have to say, federal or state funding to take care of the problems, particularly with ER care, unfunded patients who have, for many, many reasons, have no insurance, so that this unfunded mandate that we have from the federal government to take care of anybody and everybody who walks into the ER is addressed. And I don't see that so much that we can solve that necessarily on a local level, but certainly on a state and federal level. But it's going to take the population being involved and being knowledgeable. First, you have to be aware of the problem before it can be addressed.
The only way Victoria County can address this issue is to either expand the number of individuals who are eligible for the county indigent program, or to create some kind of a taxing district or taxing authority which makes the whole community take responsibility for this issue.
A property tax could do it, but no politician wants to favor another property tax. A trauma tax is important because that focuses the intent on providing trauma care, which can affect everybody. You could be the most responsible, well-insured working adult who falls off a ladder and breaks his leg or is in a car accident who will need trauma care then and now. Other ways to finance health care are left to the imagination. A nickel tax on every soft drink may easily be absorbed by the soft drink company by increasing the cost of a soft drink. And it may provide extra funds. There are many other innovative ways to create financing for health care. It's just a priority. It's just whether we want it or not.
Our leaders in the county and city have to take a look at that situation and try to propose some solutions before we get to the crisis mode. Because I personally do not think we're very far away from that situation now, and that's going to be a very painful, a very critical time for Victoria if we have some difficulty in either staffing or keeping our ERs open. I think the community, I think the city and the county needs to take a hard look at solutions. Not one thing is going to cure the problem. We have to look at our community. We're not going to be able to cure the national and state problem in healthcare. We have to be concerned about what's happening in Victoria County and the city of Victoria. I think it would help a great deal if we took a really hard look at something like a hospital district or something like a trauma care district.
The general consensus among the healthcare committee of DTAR is this. It's going to take education. Education of the community, education of the voting community, education of our healthcare professionals that we are in the process of trying to find them a solution. Don't give up on Victoria. We're in the process, we're trying to find a solution. Hang with us. But at the same time, we need solutions from both sides. Is it going to be a hospital district? Is it going to be a trauma services district? Is it going to be resolving the on-call issue among the physicians? It may be a combination of many things. Bottom line is we need to address it today, if not yesterday, because it's not going to get any better. County Commissioners Court tried to address it in 2002 with a resolution that didn't make it very far due to unforeseen instances and what have you. It's been brewing for the last 3 to 4 years on the back burner. When it comes to paying for our health care, sooner or later we're going to have to pay. Pay now or pay later. And the paying later, if you will, is by not having a physician available that's in specialty to take care of your family's needs. That's going to be the ultimate price. When enough people are turned away from the ERs because we don't have a specialist on call, and when enough people don't understand why they're being turned away and raise the flags, then the pressure will be put on the community to do something about it.
We had a healthcare committee a few years ago that studied was studying this issue, and there were members of that committee that were both from Citizens and DTAR. There were members, we had the county judge on that committee. We had representation from the city. I think we need to do that again. I think we need to get this committee started up again and have county, city, people from DTAR, people from Citizens, people from all aspects of the medical community and the business community. I think what happened 4 years ago, the people on the committee didn't have the heart to go forward, didn't think that we had a big enough problem to go forward.
When we reach that critical mass and maybe some, county clerk comes in here and has to go be shipped to Houston, and she goes home, goes back and complains to her county commissioner, maybe that's when it'll finally, that people will realize that we're in trouble here.
Somehow we've got to get the money at the local level for Victoria and at the state level to fund all the people that are there. There was an interesting figure a while back, and I don't remember the exact numbers, but it said if the state of Texas took all the money it spends on Medicaid, it could buy every uninsured person in Texas an insurance policy and have a bunch of money left over.
I see a healthcare crisis looming on the horizon. It's the same crisis, if you will, in any profession. When you cannot recruit professionals to replace the ones that are retiring or relocating, you don't have the pool of care available anymore. And once you hit that bottom end of the pool, you've got to start filling it up, or you're going to end up in a crisis where you won't have the level of health care that people expect. But it doesn't come free. Business
people should care about this. It's going to affect their ability to recruit new industry, to expand their tax base. When surveys show that the quality of care here is less than it was, it's going to be hard to recruit big new industry here. They're going to lose a lot of new jobs, a lot of new tax base. It's important to employers because these financial losses in the hospitals and other areas are going to be cost shifted indirectly into other fees and everything, so that the cost of medical insurance that they have to pay for their employees is going to go up indirectly. There's a risk of losing the trauma designation here if we don't have certain specialists, and therefore people would have to be sent out of town for minor trauma.
If you utilize healthcare services in Victoria, you're already paying the bill for the uninsured. They come to our emergency rooms. We use, physicians in the hospital use supplies, hire staff to care for these patients, and the only way we receive reimbursement is from those that have insurance. Therefore, you are in fact paying for the care of the uninsured or the underinsured anyway.
I think there's a possibility that one of our ERs could even shut down in the future. It's just gotten to where, the critical point is where, the cost just overruns you. And you cannot if you can't pay your staff and you can't pay your physicians to show up at the ER, we're going to have a situation where our ERs are going to be on a drive-by status for the ambulances and our paramedics, and they're going to be out there and they're going to try to take someone to an ER, and they're going to basically say, we can't take you. And when that starts to happen and people start being in a trauma situation and they don't survive those kind of situations because there's not an ER open or there's not a doctor there to take care of them, mostly a surgeon or in some of the other specialties, I think it's going to hit them right between the eyes, and they're going to say, people are going to start dying because they don't have the kind of critical health care here in Victoria when you need it.
We need to be able to have good recruitment, good reimbursement, some type of tort protection in the emergency room. There's a lot of factors that would help bring physicians into this community, but I'm staying here because it's my hometown. I'll take care of anybody that comes in the emergency room. It's just the oath that I've taken, and it's something that I truly believe in. But I can't speak for all my other colleagues. I've got 9 other general surgeons in this town. But if you're only one of 3 urologists, it's hard to say to your wife and your kids that, I'm sorry, but I'm not going to be available every 3rd night. You know, and then if you don't get paid for what you do, or even if you go and see this patient, you're always at risk for liability. So the non-paying patient can actually wind up costing you $1 million.
I care about the community. I was born in Victoria. I was raised in Victoria. I lived most of my life in Victoria. I know a lot about this community. It is a really, really good place to live and to work. And I know that we have a problem with our healthcare community. We have several problems with our healthcare community. I just want to get together, sit down with some people that can make some decisions and analyze some of these critical areas where we have to pose some different types of solutions. And if they come back and say, you know, everything's working just fine, you know, we don't have a problem, the doctors are just all making this up because they want to increase their paychecks, they want to increase their net income, then that's fine. But that is not the case. That's not what's happening. I do not believe it. I don't believe that's what's happening. I believe we have a situation to where it's just slowly but surely, you know, we're working ourselves up to a crisis in healthcare in Victoria County, in the city of Victoria.